Our number of new test positive cases is 43 today, which brings us to a total of 1,013 people in British Columbia who've tested positive for COVID-19. Realistically, and I've said this before, we are going to be in some form of having to monitor and prevent transmission of this virus until we have a vaccine, or until enough of the population is immune to it that it's no longer infecting people. But we know that that's a very high number. So a vaccine is something that we need to really, really push for. We are likely in our first wave right now, and we're watching what's happening in Wuhan, for example. When movement is starting again, restrictions are being lifted. And we have to go back to a different way of thinking. So when we get through this wave, which will likely be in another few weeks, it may be into May for sure, we need to start thinking about what does it look like again to understand if we're starting to see importations again, if we're starting to see clusters and cases being transmitted in the community. So we'll be going back to likely a very similar scenario to what we were about 6 weeks ago, when we were doing very active public health follow-up of anybody in the community again. We'll be doing testing on a different strategy again when we're in that place. So those are the things that we want to think about, but I do think it's more and more less likely that we're going to be able to get back to full normal life, which I miss a lot, before at least the summer. And then we need to start preparing ourselves for the potential of a second wave in the fall. In the meantime, we need to put every possible effort into development of a vaccine.